Craig Lopez. I'm a fifth-year resident at the University of California, Irvine. Thank you for joining us today. Today we're going to be just talking about the fundamentals of orthopedic surgery, our surgical simulator, which we created here at the University of California, Irvine. This is meant to be an adjunct to what we already have online. We have the PDF for how to build the board. We have the PowerPoint on why we use it. And today is to show you how we use it at University of California, Irvine, taking you through each task and how we practice with it, we grade it, and objectively assess it. Thank you again, and we'll take you through each task now. The first task we'll start with is our fracture reduction task, where we have a fracture created from PVC pipe using a chevron osteotomy here. We have it covered with pipe insulation, which simulates our soft tissue envelope. On either side, it's attached to separate components. One side is a translation plate, which is tensioned with a bungee cord, which allows for a shortening force. And on this side, we have a Heim joint, which allows for a rotational force, which is also tensioned using a bungee cord. We have point reduction clamps to allow the participant to reduce the fracture within the soft tissue envelope. For the task measurement, we test from picking up the clamps to anatomical reduction. For practical use every day, we will reduce the fracture, clamp across the fracture, and then perform various type of plating techniques. And once that's done, you can put a new PVC pipe fracture into place and attempt a different reduction. For testing of the fracture reduction model, we have displacement of the fracture. The participant then picks up their bone forceps, unlocks them with either hand, and puts them into position, staying inside the soft tissue envelope. However, they are not grabbing the soft tissue envelope as they would do in the operating room. The model is finished once the fracture is reduced. The next task is what we call three-dimensional control of the drill bit, or triangulation with the drill bit. The participant has three separate color-coded dots that are on a 4-inch by 2x4. And on the other side, they have other exit points that are color-coordinated as well. The participant places the block into the vice grip. They'll start on one of the color-coded dots, so they start on red. They'll look at the red dot on the contralateral side, and they will try to triangulate using their drill bit to drill from point A to point B. To practice this task, we draw an X on the entry hole side. We maintain the exit hole positions, and the participant will drill towards the exit positions from different points along the X. This allows each block to have 20, 30, 40 different attempts at triangulating your drill bit to the other side. So assessment of this task. The time of the task begins when the participant picks up the drill bit. The ending of the task is when the participant exits the contralateral side. The two assessments are taken are time from start to finish, as well as millimeters from the center of the dot to millimeter to the center of the hole. For example, the participant will pick the green dot, put their drill bit into position. They'll find the other side, and however they would like to triangulate, they use that form. Participant starts perpendicular to the board, begins their hole, and then works their way into the correct final position. And there's the exit point. This one we have a known start point and we have an unknown exit point. And in fluoroscopy, how we understand where the exit point is by using two perpendicular planes, an AP and a lateral. For this, we use a similar idea where we have two perpendicular planes of the block which describe to us where our exit point is going to be. So if we use green as a start point, then we'll look down one plane of the block and you'll aim your drill bit in this plane here. Once you have that plane determined, you then will turn your attention to the one 90 degrees turn to that and aim your drill bit in this correct plane. Once you have both planes determined, you try to guess your exit point. These two lines intersect to form your exit point. Participants practice with this task by drawing an X on the entry hole position. They still maintain their covered exit points, and they still maintain the same triangulation points along the edges of the block. But this way, the participant can aim for different exit points approximately 30 to 40 times per block. So for this task, we assess both time and accuracy. Time begins when the participant lifts the drill, and time ends when they exit out the contralateral side. For accuracy, again, we measure from the exit point, the center of that hole, in millimeters to the center of the attempted dot. The participant may need a chair for this exercise. Here's an example. So the participant will lift up their drill. They'll pick a dot. In this case, we're picking purple. They'll look down the top, aim towards the exiting point in this plane, hold their position in that plane, and they'll check the 90-degree orthogonal view. They'll move their hand in conjunction with that plane, and once they have a good trajectory, they will go ahead and attempt to hit it. The next task is plunge minimization, where we have a PVC pipe attached to the board using zip ties, and they have a foam box underneath this. What the participant will perform is drilling multiple holes through the PVC pipe, limiting how far they plunge past the second cortex. We assess both time and accuracy for this. Time begins when the participant lifts the drill bit and ends when they have finished drilling their fifth hole. For accuracy, we use the backside of the drill bit and measure how far the participant had plunged into the hole after the exam is complete. So the assessment of the exam begins when the participant picks up the drill. They drill through the far cortex. They'll drill 5 holes in consecutive order. For measurement, we use the backside of a drill bit and lightly press into the hole, clamp this portion, and then measure it using a ruler. The next task is our drill by feel task that we liken to placing a femoral external fixator pin, where the participant uses tactile feedback from their drill to appropriately place the pin. For this task, we have a flat board which has a lawn drawn down the center of the middle. We place this within a foam insulation wrap, and it's attached to the board on either end using a clamp, and it's covered up by post-it notes. The goal of this task is for the participant to plunge into the soft tissue using the tip of their drill bit, feel for the top and the bottom, and estimate where that center line is. For assessment of this task, we assess both time and accuracy. Time begins when the participant lifts the drill and ends when they're finished drilling the third hole. For accuracy, we measure from the center of the hole drilled to the center of the line. So again, here's an example. Participant lifts the drill bit, feels the top of the board, bottom of the board, estimates where the center is, and then exits the soft tissue envelope. They'll re-enter again, walking along the wooden board, estimate where the center is, drill another hole, and then again entering the soft tissue envelope. At that point, time will be stopped. Once the drilling is finished, the participant removes the clamps, removes the board from the insulation, and measures their exit points. The last task that we have is a low-cost suturing board, where we have a PVC pipe, foam insulation, with a strip of duct tape laying over top. This helps prevent suture pullout. It attaches to the board by using our galvanized pipe. It has one end where the PVC pipe is able to be slid on, and the other where it's screwed on. This both gives a stable base, but also gives it a little bit of play. The other instruments you'll need are going to be a needle driver with suture, forceps, along with suture scissor. For assessment of this task, the participant sutures as many simple interrupted sutures over a 4-minute time span. For practice with this, the participant can use a number of different suturing methods, but the goal of this is just repetition. Here's our soft tissue defect. The participant picks up their suture and sutures across the soft tissue defect, placing a simple interrupted suture into position. Thank you for watching. It's our hope that this can positively impact the surgical education at your program.